The Brigid Alliance was created to confront the many systemic injustices and logistical hurdles that abortion seekers face when trying to access abortion care. Legal barriers, financial barriers, disparities in health access, and misinformation, stigma, fear. These barriers were discussed in depth in the groundbreaking longitudinal research conducted by one of our guests today, Dr. Diana Greene-Foster. Dr. Greene-Foster is the architect of that research called the Turnaway Study, a years-long research project that provides evidence-based and evidence-backed insight into the ways that both getting an abortion and being denied an abortion affects a person's mental health and well-being. This research has helped shape the Brigid Alliance into the organization we are today. And today, Dr. Greene-Foster will be discussing her most recent publication, Changes in Abortion Access, Travel, and Cost Since the Implementation of State Abortion Bans 2022 to 2024. The study came out in July of this year in the American Journal of Public Health and is part of the End of Roe study. What is remarkable about the study's conclusions is that it reflects something that we at the Brigid Alliance have known anecdotally for a long time. Abortion bans that followed the Dobbs ruling are creating barriers that force abortion seekers further into gestation, increasing the costs of their care and requiring them to travel further distances for longer periods of time in order to access care. And that these barriers are most severely felt by those who are later in pregnancy, those without money or resources to travel, minors, undocumented immigrants, people with disabilities, and people who are incarcerated or hospitalized. And now, as a result of the work of Dr. Greene-Foster and her colleagues, we have data that reflects this anecdotal experience. And with that, I'd like to welcome Dr. Diana Greene-Foster. We are so grateful to have you with us today.
Thank you so much. It's a pleasure to be here. I really feel that it's important to support the Brigid Alliance, not from an advocacy perspective, but from a science perspective. I've done a lot of work that focuses on people having later abortions, and it's a topic that's often totally misunderstood. And so I just want to go back a little bit to the Turnaway study before I discuss the latest paper. This study, we recruited people over 3 years from 30 abortion facilities across the country, where if you're too far along in pregnancy to get an abortion at that facility, there's no place within 150 miles that could provide care later. So most of the people turned away carried those pregnancies to term. And this is before Roe was overturned. So it just shows you that Roe was not enough to enable people to get the care that they wanted. And when we followed people, first of all, we excluded people who had fetal diagnoses or maternal indications, maternal health indications. I know Brigid Alliance doesn't exclude those people, but who we had in the study are usually the people who are least protected by law. And we also had a first trimester sample because 90-something% of people who get abortions do so in the first trimester. And at least pre-Dobbs, that was the case. And so we wanted to know whether these people having later abortions had a typical experience. And the study ended up in over 50 scientific papers, a TED Talk, and a play, and really makes Dr. Shelley Serra is one of the few public providers of abortion in the third trimester, and she just published a book which says, if you can understand third trimester abortion, you can understand all abortion. And I think that's true because really the people getting later abortions are not very different from the people who got early abortions. They're not less important with less promising trajectories in their lives. What we found, though, is that when we characterize people who get abortions at 20 weeks or above, they're much more likely to be they fit into one of 5 profiles. They're single moms, they're either depressed or using illicit substances, they're having some conflict with their male partner or domestic violence. They had trouble deciding about the abortion and then had problems accessing care, or they were young and had never been pregnant before. And maybe that makes it seem like they're odd in some way, but in fact, those describe a lot of people, and it's intended to help paint a picture that there's a wide range of people who are included in the those who need later abortion care. And we also published from the Turnaway Study a paper about late discovery of pregnancy, because that's a leading reason why people get later abortions, is that they didn't realize they were pregnant earlier. And when we do interviews with them, we find out that recognition was delayed because they either didn't have pregnancy symptoms or they have some other condition that has symptoms in common with pregnancy, which is a lot of chronic health conditions, and also includes having recently given birth to a baby, can make your cycles abnormal, can make your whole body hurt, and all of those are can be confused with pregnancy symptoms. And so these are the people who are these are the reasons people give us when we interview them about why they needed a later abortion. But then when we look quantitatively at the statistics, what we see is two factors are statistically significantly associated with needing an abortion, with discovering you're pregnant into the second trimester. And that is people who've never given birth before. So there may be either young people tend not to have regular periods anyway. Maybe they don't recognize pregnancy symptoms. Maybe they don't think it could happen to them. And then number two is they were using contraceptives in the month they conceived. So if you think that you're protected because you were using a contraceptive method, you can be slower to recognize that you were in fact, that it hadn't worked and you were in fact pregnant. But it disabuses people who think that it's somehow irresponsible to not realize you're pregnant. Is in fact, it can be because you were actively trying to prevent pregnancy. So now I'm working on a new study of the consequences of the Dobbs decision. And we started by recruiting people before, who had just been served before bans took effect, and recruiting people after who either had their appointments canceled or called trying to get an appointment when the clinic had already stopped serving people. So there's this ability to see what was the experience of getting an abortion before the Dobbs decision and after. And we're focusing here on the 14 states that have banned abortion. And what we found is these are people seeking clinical care. So there's a whole nother group of people who are ordering pills online. And that's not who's in this study. And it's not who I believe the Brigid Alliance is primarily serving. So this is people who want to get a clinic-based abortion. And what happens is that the travel time goes from just under 3 hours to over 11 hours. And people are no longer just driving. Now they're taking trains, buses, and planes to get to a clinic. They're crossing state lines. And they're much more likely to need to have an overnight stay, which no doubt increases the cost and makes it so much more difficult for people with children. So from 5% to 58%. And then when we look at the timing of care, what we see is that the Dobbs decision resulted in a doubling of the fraction of people who got second trimester abortions. So it was 8% prior to the bans taking effect. That's consistent with national data. And went up to 17% after. And why is two reasons. One is it takes a lot to arrange travel and figure out where to go across state lines. So people were going very long distances. They needed time to get all the information they needed to raise the money. But the other thing is that there was support. So all of the anger around the Dobbs decision resulted in a mobilization of a system to help people get care. And some of that, I believe, is people who wouldn't have gotten care pre-Dobbs are getting it post-Dobbs because these support systems became so much stronger. So there's this critical role for support in the post-Dobbs era. There'll always be people needing later abortions because of late recognition of pregnancy, but these bans make it even more likely people will need later abortions because they force people to travel for clinical care. And these rage donations after Dobbs, just allowed a massive mobilization of support networks and were critical in what is clear is that many people are getting their abortions. There hasn't been a massive increase in the birth rate as a result of the Dobbs decision. And it's partly because of Pills Online, and it's partly because of these support networks that enable people to travel for clinical care. And my concern is that now there's so much to be outraged about that we need to sustain the mobilization efforts to help people who want an abortion and live in a state with a ban. And just one more minute to emphasize why this is important is that the rest of the Turnaway Study findings, not the ones about who seeks care, but the consequences of not getting care, indicate that when people are unable to get an abortion when they decide that it was the right decision for them, they are more likely to be poor, to end up below the poverty level, to not have enough money for basic living needs, to not be able to support their existing kids, to not have wanted kids later at a better time. They're much more likely to experience violence for a period when they are unable to get an abortion. They end up still in contact with violent partners, and they're less likely to set and achieve aspirational plans for the future. So the stakes of this are very high. It's being able to get an abortion when someone thinks it's the right decision for them is critical for their life course and their children's well-being. And I'll turn it back to Sarah.